Hello, it's Anna Hill here with the Farming Today podcast. As President Trump arrives for his state visit, dairy producers are concerned trade negotiators could give the US access to UK dairy markets, putting our industry at risk.
They are, quite frankly, overt about their approach and ambition to seeking new customers overseas. I see no reason why Britain won't be seized as a prize marketplace.
We'll have more on that a little later. First, all week we're exploring the state of rural services across the UK, from transport and housing to postal services, and today, health. A report published this summer by Rural England, a not-for-profit research body, showed that 35% of rural hospitals closed in the last 15 years. In a moment, I'll be talking to the chief executive of the Nuffield Trust about health services in rural England. But first, we go to Scotland. The Ardnamurchan and Morvern area in the west coast Highlands of Scotland is remote, with scattered villages and an ageing population. Several years ago, NHS Highland closed the area's only care home, which prompted the setting up of a local charity, Urim, to help provide a range of health and social support services. Kathleen Carraher caught up with Chairman James Hilder and Transport Manager Tracy Cameron as they helped organise a community lunch.
So this one was just pieces, Stevie and Ray, isn't it?
Yeah. James, I presume that Urim is a Gaelic word?
Yeah, it's Gaelic for respect. And so when we were setting up the charity 5 years ago, we wanted something that encapsulated, what we were trying to do. We've got about 2,000 people. It's about an area the size of Berkshire. So it's really, really sparsely populated. About 160 miles of single track roads. So we're very spread out. So the work we do trying to connect people, that's why our transport service has been the biggest project. We acquired a vehicle and we started recruiting volunteers, and it's grown from there. So we have about 15 regular volunteers that will help take people to hospital appointments, medical appointments. So we now have 4 vehicles and cover about 50,000 miles a year. Also, we work in partnership with Highland Hospice to do a befriending service. It's a long-term relationship. We're trying to match people together so you get a visit, a cup of tea, and it's just about reducing isolation and giving people something else to do in the week. And so we've got about 14 regular befrienders. We're looking for some more volunteers, but it's tricky. You've got to match the right people with the right interests.
You also help to provide personal assistance for care for elderly people. How does that work?
What we've been trying to do is find out who are the sort of people that can offer a service and make them with the people that need it. So we're actually bringing the two together. And sometimes that could be whilst someone is waiting for some assistance, having come out of hospital. So it's a short-term thing. Other times it can be a longer thing.
The lunch here in a Harrickle village is organised by the local community company. Urim is providing some of the transport, but Tracy Cameron has to juggle with other issues and priorities.
Hopefully we'll have about 20 to 25 people today, but maybe less because there's a road closure which might stop 6 of our regular lunch users coming to the lunch club.
It's still a good turnout, right?
It's not bad. And we've got hospital transport journeys to Inverness today as well that had to leave early because of the road closure.
Donna is a regular lunch goer.
Why? Well, it's just meeting everybody. Saves me cooking as well. But no, it's just nice to get together with everybody and chatter.
The food's excellent.
Sorry?
The food's excellent.
And the food is excellent, yes.
Absolutely.
Lovely, thank
Is that
you.
enough?
There's so much unmet need and there's so many people needing help. I think Urim fill that gap, and I think it's our duty and responsibility to make sure that people get the services that they're entitled to, that they might find easier to get in a bigger town.
James, in your mission statement now, you talk about sometime in the future that Urim may well be the provider of care here in Ardnamurchan, either in cooperation with NHS Highland or even by yourselves. That's a very ambitious statement.
Care comes in many, many forms. Our feeling is that to really give people the best care, we need to make those connections with the statutory services and with all the different types of volunteer groups that exist, and that going forward, that to really keep a remote area like this vibrant, we need to be there. And yes, I think we will be part and parcel of an awful lot of these connections.
That report from Kathleen Carraher. Although not as remote as some parts of Scotland, many of the problems providing healthcare are remarkably similar in villages and market towns across rural England. The government's 10-year health plan for England, launched in July, recognised that rural health provision would need to be tailored to specific needs, but it didn't ring-fence funding for it. Thea Stein is Chief Executive of the Nuffield Trust, an independent health think tank. She outlined the challenges.
Some of the issues that we see are issues around the recruitment of staff. And that also then means that the organisation itself, it could be a hospital, it could be a community venture of some sort, have higher overall staff costs as well. We know that there are huge distances that people are sometimes travelling, both between appointments or indeed to get to appointments. So you've got the higher staff travel costs, and you've also got the issue of thinking about your population and how you're going to get them to a centre if you are not going to them. It tends to mean as well that the cost of providing healthcare in a rural area can be higher because you're trying to provide a high quality healthcare service or dental care, whatever it is you're doing, in somewhere which is more sparsely populated.
In July, the government published its 10-year health plan, and that seems to focus on local provision. It does mention specifically rural and coastal areas. Do you think there's enough specificity in there or ring fencing for funding for rural areas and health provision?
The government have made it clear that they want to take away ring fences and they want to take away a level of specificity in order to allow local areas, so a local health board in Scotland, a local integrated care board, integrated care service in England, to make their own decisions. So if you're looking after a local area that has within it a major city, a major conurbation, and rural and coastal areas, it's for you to make the differential decisions about how you invest the money locally.
Is that going to work?
I don't think any of us know. We have to see. I think we know that in other countries, there is a much higher level of delegation to that more local area. It has worked in some places, but you need to have the right levels of getting people involved, the right levels of thinking to try and implement that.
Are there any solutions to reduce the costs of rural care, do you think? Any creative ideas that could be taken up?
Yeah, I think what we've seen, it's always interesting to look somewhere like Australia, which is beyond rural, some of their rural areas are the size of our country, and look at the way in which they have really innovated in the fields of digital health and being able to give more care into people's homes, into very remote areas, using telecommunications in a completely different way. But I think we've got a lot more that we could do with rural areas where there are assessment, evaluation. Even I saw recently some extraordinary work on physiotherapy, giving people a diagnosis, help and support, but not actually hands-on in a clinic. And I think there's more that we can do through the use of innovative technologies to allow us to take services to people's homes, but actually not meaning that we've got staff who are travelling long distances all the time. I think that's one of the hopes for the future, potentially.
Thea Stein, Chief Executive of the Nuffield Trust. As President Trump arrives for his state visit today, apart from the pomp, there'll be an opportunity to continue trade negotiations between the UK and the US. With that in mind, farmers and milk processors have written to the Prime Minister warning that opening up more US access to the UK dairy market could put our industry at risk. The US-UK trade deal signed earlier this year included beef and biofuels, and the Trump administration has been clear that it wants other foods included in the next phase of negotiations. The chair of the National Farmers Union's Dairy Board, Paul Tompkins, told me why he's concerned dairy could be targeted.
Trump's America is often blunt about its ambitions in food trade. But there's no doubt that seeking market access for their farmers is seen as a key prize in their negotiations. The US dairy market does have exportable surplus. Their industry is built on exports, and they are, quite frankly, overt about their approach and ambition to seeking new customers overseas. I see no reason why Britain won't be seized as a prize marketplace.
Why are you so concerned, though, about imports of US dairy?
In the United States, dairy operates at a vast scale under very different regulations that permit practices that UK farmers refrain from using. So good examples are the use of BST or hormones in a small part of US dairy production, and also antibiotics that are reserved for critical use in human health in the UK.
You've sent a joint letter with Dairy UK, which represents processors, laying out the position that UK farming can give no further concessions without suffering serious impacts to its viability. Why are you using such strong words?
Well, I think that dairy farmers are pretty cheesed off at the prospect of liberalising our markets to the US. Our farmers have already shouldered much of the burden on behalf of other sectors of the economy in the first round of negotiations with the United States, and we simply have nothing more to give. I believe that domestic standards have got to be protected in trade negotiations, and I guess that sentiment is echoed by dairy farmers across the country.
Is there any indication that the UK would be a destination for large amounts of UK cheese or milk powder, even if trade were liberalised? At the moment, imports of US cheese and dairy are relatively small, aren't they?
Currently, we don't import many dairy products from the United States, but that is because we are protected by existing tariffs. And if you consider this deal in context of what's happened over the last couple of years, so we've had a free trade agreement with both New Zealand and Australia, the former being a large dairy exporter, and more latterly the free trade agreement with India, who are the largest dairy producing nation in the world and have ambitions for significant dairy surplus. I think when you build these together, you see that we're building up a picture of a lot of exposure to extra dairy products coming in from abroad, when our ambition is to have a strong domestic supply base in order that we can maintain food security in this country.
Could there be greater opportunities to export to the US if a deal is reached to reduce tariffs on cheese exports from the UK to the US? I mean, yesterday we heard from UK cheesemakers who were worried about competition from the Irish, who currently have lower tariffs on exports of cheese to the US.
I think we recognise that, especially for the organic sector and artisan cheeses, there is valuable export opportunities for the UK in America. But we would ask that this is done on a reciprocal basis. The small amount of cheese that is being exported to America, I think dairy farmers would find it much more tolerable if it was matched rather than we were liberalised.
Are you going to make the case for the UK dairy industry to be protected on standards of production?
Well, it would seem sensible to me that the government could establish a set of core production standards that we can all agree to, that would both apply to homegrown food and imported food. Otherwise, each time we look at signing trade deals around the world, we're going to be repeating this discussion. So let's set an agenda, a place, a task force that we can actually iron out these issues, in order that when our trade ministers are routing their way around the world looking at new trade deals, that they are underpinned by our food standards.
Paul Tompkins from the NFU. That's all from us. I'm Anna Hill. The producer was Sarah Swadling. Farming Today is a BBC Audio Bristol production.